Hello and welcome to Pisgah Health Today. My name is Angela Owen. It's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Reverend Scott Rogers, who is the Executive Director of ABCCM. Welcome to our program today, Scott.
Angela, it's such a joy to be with you, and we're just honored to share what the Asheville Buncombe Community Christian Ministry, or ABCCM as we're known as, is doing.
Well, excited to learn from you. I understand that you have served since 1981 in this particular role, and as you said to me before we started, you have been honored to serve 39 years with this mission to care for the hungry, the homeless, the veterans, and the underserved, by networking and really collaborating with so many people. Your favorite saying is that I collect friends, as you like to say, and I look forward to learning more about that as we just get going here. So Scott, why don't you tell us a little bit more about the mission and ABCCM?
Sure. Well, thank you for that opportunity. The ABCCM just is so unique, but yet has so many sister ministries around, such as Transylvania Christian Ministry, Sharing House in Brevard. It really began in 1969 out of the civil rights movement, when churches were asking, how can we listen to our neighbors and meet their critical needs? And so it was out of that kind of Bible study and then a group of churches coming together and then saying another really important question: how do we create an opportunity to serve so that those in the churches and faith life that want to express their faith understanding and to listen and care for their neighbors in need, how do they do that? And could we create that opportunity? That's really ABCCM's mission in a nutshell, is to create an opportunity for the next person to serve and be with us so that we can take in the next person or family in need. And that's what we've been doing, so much so now that the ministry has grown and expanded, where in Buncombe County we have 5 crisis ministry centers, north, south, east, west, and downtown. We also have a jail ministry. And then one of the things that grew out of that jail ministry fairly quickly was how many folks were homeless. And we had a terrible incident in the winter of 1984 when we had a late freeze and snow, and Master Sergeant J.D. Buckner froze to death on our streets. It provoked such an outcry that the churches came together again in a powerful way to say, we don't want anyone to freeze to death. And so we worked in homeless ministry and expanded that in partnership with the Salvation Army, the rescue mission that we had helped found. And ABCCM grew that way until we were taking men and women and then moms with children. And in 2002, we opened the women's facility. And in 2008, we took a bold step of saying we want to take every homeless veteran off of our streets. Bought an old motel in East Asheville, and the men called it the Veterans Restoration Quarters because it restored their lives. Part of that shelter ministry drew in nurses and doctors who began not only caring for the feet and the physical health of homeless men, but also the women and the moms with children. And that began the first free clinic. Reverend O.T. Toms, one of our leading African-American pastors, spearheaded that from 87 to 91, when the doctors told him in 1990 we had to have a Good Samaritan law. He said, fine, we'll go out and get one. and we did, and with other churches and folks that wanted to do medical ministry across this state, and it began in 1991. So we really cover all of those areas at the what I call the corner post, the gatehouse of poverty. So whether it's folks who are in criminal justice, folks who are homeless, low-income families, the working poor and uninsured, ABCCM has ministries designed to meet those needs. And then lastly, I'll just add our veteran services in 2010 and 12 began to expand into homeless prevention. So we're actually right there in Buncombe County almost every day with a veteran services of the Carolinas, outreach worker, case manager, and we now operate a veterans call center across 74 of the North Carolina's 100 counties. We have the largest private veterans employment and training program in North Carolina. We will train and place over 450 veterans into jobs this year. And we also do a great deal of homeless prevention. We will help 300 families, particularly in Western North Carolina, keep their homes, or if they are evicted, get into a home, usually within less than 90 days as part of our rapid rehousing and homeless prevention program. So that's it in a nutshell, Angela.
Scott, it's beautiful to see how recognition of a need and that heart to develop opportunities to serve has just snowballed into so many things. And I'll just applaud one particular area since we are recording this the week of Veterans Day here in the United States. Just that focus work on the veterans, and most recently here, this homeless prevention work. I just applaud that, recognizing that so many need that help and that willingness to come alongside them. So well done to you and your team for putting all those pieces together and continuing to have it snowball. As you see something else, you're putting together more pieces.
That's what churches and people with big hearts and compassion do. Once they get their arms around one need, they embrace the next. And that's why it's such a joy to work with Pisgah Health Foundation, because they too want to embrace those next needs to help make families' lives healthier and safer.
So Scott, speaking of the Pisgah Health Foundation, how will the recent grant from the foundation help you in serving Western North Carolina?
I tell you, the Pisgah Health Foundation's grant came at just the right time. I mean, it was right there when we were starting into this pandemic. There were so many unanswered questions, and we saw this huge waterfall of families being laid off, people losing their jobs and furloughed and out of work. Unemployment hadn't really gotten started in April and May and June. And so we saw immediately our numbers for families needing food, also the homeless who were unsheltered, needing meals. We went from about 85 families a day coming to us to 130 families a day.
Wow.
When you start to add that up, we had one week that topped 1,000 families in 1 week coming mostly for food. Thank God for the moratorium on light bills and evictions. But then we also saw the homeless. Those needs doubled. They went from an average of about 65 to 70 a day, upwards of 130 to 150 a day. And of course, that was because there were new homeless. And then another big spike was that folks couldn't get their medications. They were out of work, money was short, they couldn't meet those co-pays. Our pharmacy stepped up, as well as our clinic. taking care of the uninsured, helping those that we have always taken for granted. When you're working and you're diabetes, you need your insulin, your asthma medicine, your hypertension medicine. Those simple basic things were no longer easily accessible, and sometimes people were going without way too long until they found us. And our clinic, which is the only free clinic in Buncombe County, was able to meet that need. The numbers went from 300 a month to 900 a month.
Wow.
So Pisgah Health Foundation stepped up at just the right time when we needed to leverage food. I tell you, our partners at Ingalls, they allowed us to purchase $60,000 worth of food for $20,000. Other discount places allowed us to get hygiene items. Some of the Dollar General stores, Aldi's, all these folks recognizing that they needed to take care of their neighbors in the community and joined together. Just like I heard from Shelley Webb yesterday that happened in Transylvania County with Sharing House. We shared the joy and honor of creating those opportunities to help families in need.
We certainly love Shelley here, and sounds like, as you're just talking about, even just the incredible challenges of 2020, your collection of friends has really come a long way in being able to be a part of giving back into the community. Scott, before we wrap things up here, what else would you like our viewers to know about you and the organization? How can they come alongside you? How can they get involved? Just what else is important for us to know?
Thank you, Angela, for that opportunity. We try to really make it simple and also fun. There's a couple of things. First, if you're interested in a tour or volunteering because you feel that nudge that, well, if I knew it was safe and I'm ready to get out and help, what would I do? And it's simply go to volunteer at abccm.org. If you want information, it's just info at abccm.org. You'll find folks very responsive in less than 24 hours, usually the same day, to those kinds of requests. If you're a veteran, I wanted to pick up on Angela. We thank God for you and your service. We have put up, as far as we know, the first and only Veterans Honor Wall. You can go to abccm.org/honor veterans, and you can honor the veteran in your family. We ask for a simple $20 contribution because that $20 will go directly to outreach for veterans and meet those basic necessities for food, clothes, job training, and so on. Those are the things that we would encourage folks to do. And of course, if you go on our website, just at abccm.org, it simply says pray, serve, give. There's a little button that you can give in less than 5 minutes. It's very straightforward. And we would appreciate that because one of the hallmarks of our ministry are twofold. One is on just a straight dollar to services basis, 94 cents of every dollar goes directly into services. We keep it low because, as we said, those 5,000 volunteers make that possible. But then second, we leverage your dollars and multiply them 2 times, 3 times, like you heard with Ingalls, that we can do that you can't do on your own. And that's why we call us together. So, Angela, I'd just like to close with this simple prayer. If folks would join me. Lord, take our hands, work through them. Lord, take our lips, speak through them. Take our minds, think through them. Take our hearts and set them on fire. Thank you so much for for allowing me to share those words and that message with you today. And thank you, Pisgah Health Foundation.
Scott, wonderfully said, and thank you so very much for being here today. And on behalf of the Board of Directors at Pisgah Health Foundation, I would like to say thank you to you, all of those volunteers and the rest of the staff at ABCCM for all the hard work that you're doing to serve Western North Carolina. It's been a pleasure talking with you today and getting to know you a little bit and learn more about your organization. And thank you so very much for being part of today's program.
Thank you, Angela. God's blessings.
Thank you. We also would like to thank Wildflower Media for their creative and technical support, as well as thank the Board of Directors and the staff at Pisgah Health Foundation and the Physicians Roundtable. Until we see you again on the next Pisgah Health Today, stay well and be well.